Thank you. Next, we have Dr. Anjitha B.S. She'll be talking on primary versus secondary IOL implantation in congenital cataracts, a comparative study.
A very good morning to one and all. So my topic for the study is primary versus secondary IOL implantation in congenital cataract, a comparative study. So congenital cataracts are the third leading cause of visual impairment in children following congenital glaucoma and inherited retinal disorders. Numerous prenatal, metabolic, toxic, viral or genetic disorders are typical factors linked to its gradual development. And to avoid irreversible amblyopia, surgery for a congenital visually significant cataract must be done as promptly as possible. And the controversy remains on the method of correction of the resulting aphakia that depends on the age of the child at the time of surgery. And intraocular lens implantation is typically required to restore vision, though primary IOL implantation is not generally recommended for children aged less than 2 years of age. And the aim of the study was to compare visual outcome, principally the myopic shift, visual acuity and biometric profile between children who have undergone primary and secondary intraocular lens implantation following congenital cataract surgery. And our study design was a retrospective intervention study that include children with congenital cataracts who underwent either primary or secondary IOL implantation at a tertiary care center during the period from 2010 to 2020. Study duration was 20 months from December 2022 to July 2024, and the sample size was 112 patients, 56 in each group. And pre-operative and post-operative assessment of each operated eye in terms of axial length, refractive errors, ocular alignment, and post-operative biometric profile and best corrected visual acuities were collected. And the subjects were classified into 3 groups, that is from 1 to 5 years, 6 to 10 years, and 11 to 15 years for age-associated biometric changes. The biometric profile parameters were measured using the IOL Master 700, and the data were retrieved and reviewed. The primary IOL patients averaged, the mean age at surgery for primary IOL patients averaged for 84 months compared to 5.9 months for primary surgery in secondary IOL patients. And the inclusion criteria was congenital cataract, both bilateral and unilateral, normal corneal diameter, normal intraocular tension, and patients with at least 1 year post-operative follow-up. The exclusion criteria was we excluded patients with microcornea, microphthalmia, megalocornea, then anterior or posterior synecdoche, elevated intraocular pressure, and patients with any other ocular pathologies, poor fixation, and cataracts other than congenital cataract. And the procedure was performed under general anesthesia, and it includes creation of a corneal incision followed by anterior capsular rhexis and lens aspiration. Then posterior capsular rhexis and anterior vitrectomy is done for all patients younger than 6 years old, and implantation of intraocular lens or leaving aphakic for later correction depending upon the age. And the data was entered in Excel and analyzed using the SPSS software version 20. And coming to our results, in our study comparing 112 participants, unilateral surgeries were more common in both groups, and a best corrected visual acuity of 6/6 to 6/9 was reached by 71.4% of the primary group versus 17.9% of the secondary group. And the proportion of patients with best corrected visual acuity worse than 6/24 was significantly higher in the secondary IOL group compared to the primary IOL group. And on comparing, on comparing the postoperative outcomes, between the primary and secondary intraocular lens group, significant differences were noted in ocular alignment also, and the primary IOL group had no cases of esotropia, while 14.3% of the secondary group did, and exotropia was observed in 5.3% of the primary group versus 21.4% in the secondary group, and nystagmus was seen only in the secondary IOL group. And this comparing these results in biometric profile, this highlights the significant biometric changes, especially in axial length and AC depth following cataract surgery compared with normal children of the same age group. And a good visual acuity was achieved by 67.8% of the primary IOL group compared to just 17.9% in the secondary IOL group, and that highlights the critical period for visual development in pediatric patients. And this findings aligns with the critical periods of visual development proposed by Mohammed et al., emphasizing the necessity of early and effective visual correction to prevent amblyopia. And the ocular alignment outcomes showed a significant incidence of strabismus in the secondary IOL group, consistent with the findings by Trivedi et al. and the nystagmus was absent in the primary IOL group but present in secondary group, emphasizing the importance of early visual rehabilitation in preventing sensory deprivation nystagmus as suggested by Lambert et al. And both groups demonstrated similar axial length measurements and changes with significant myopic shift in the secondary IOL group. And a notable post-operative biometric changes, particularly in axial length and AC depth in both primary and secondary groups, aligns with the results reported by Abrar et al. And our conclusion is children operated with primary IOL showed significant improvement compared to secondary IOL, and the incidence of strabismus was significantly lower in the primary IOL group, and the changes in axial length and AC depth were similar in both groups, and the findings emphasize the critical role of early IOL implantation in preventing visual deprivation, amblyopia, and strabismus. So these were the strengths and limitations of our study. Thank you.
Primary IOL means what?
Sir?
Primary IOL told at what time the surgery was done?
Sir, primary IOL was done for children aged more than 2 years of age.
Then what about suppose the congenital cataract is significant? When do you normally advise surgery when?
Means if a cataract is significant, if it is a unilateral cataract, significant unilateral cataract, then surgery is done immediately.
Bilateral?
But bilateral significant cataract also
that time you are not applying IOL. That time you are not supposed to apply IOL, no? Suppose you are doing within 4 and 8 weeks, how can you apply IOL?
For less than 2 years of age, we don't recommend a primary IOL implantation.
You have to do surgery, no?
Sir.
Then you are telling primary IOL after 2 years. The first surgery you have done without IOL only.
First surgery we maintain the patient aphakic and we use other optical correction like contact lens.
No, you told primary, secondary IOL.
Yes, sir.
So first surgery you have done without IOL.
Yes, sir.
You are told primary IOL done after secondary 2 years means why? I do not know. I can't understand.
Sir, primary IOL is done for if the patient is aged more than 2 years.
That is okay, man. That means first surgery was not done before 2 years.
If the surgery is done before 2 years means then we maintain the child aphakic, sir.
Aphakic, but the surgery you are telling, secondary IOL.
Secondary IOL surgery is done after like 20 months.
That is okay. First time you are doing surgery, you have not done IOL.
Sir.
Second time you are going to implant IOL. That is called secondary IOL.
Yes, sir.
But first time you have not made aphakic, then second time you are applying IOL. Now you are telling primary IOL, secondary IOL. Something is confusing.
Primary means only one procedure.
For primary IOL implantation, there is a single procedure that we do for patients aged more than 2 years.
That means nystagmus naturally you can expect because macula develops by 16th week. Naturally you can expect nystagmus to come and squint to come. Why did you wait for 2 years for this first surgery?
Pardon, sir, I didn't understand.
See, if you wait for 2 years and all, naturally the child is liable to develop nystagmus and squint. You are telling primary IOL done at 2 years means that means you have not done surgery before that. You have to make IOL, child aphakic only, so that the light can go inside and exact the macula to develop. Otherwise, macula will not develop.
Sir, but the outcomes, like we are comparing the outcomes of...
The word you are using is, I feel wrong. Because you told primary IOL up to 2 years, there is something wrong. Understand now? You are able to follow me. Normally, you are supposed to do congenital cataract surgery if it is significant within 8 weeks.
Yes, sir.
That's the ideal time. That time you are not going to apply IOL. Now you have to apply IOL means now you have to wait for 2 years or something you are waiting.
Yes, sir.
That is called secondary IOL only. Secondary surgery only you are doing. It's not primary IOL.
No, sir. We are comparing the outcomes of both patients, like how what is the myopic shift, visual acuity, etc. for both primary and secondary.
I'm not concerned with that. The word you are using is primary, secondary. I am having my own doubt. That's all.
Okay.
Okay, thank you.
Thank you.